Minister, there's 40,000 people almost that have died since your government came to power in 2016. You've spent about less than 1% in terms of responding to the toxic drug crisis that you spent on the response to COVID-19. That is purely the stigma that's attached to what's going on. And I want to know when your government's going to prioritize this issue and make it an urgent response. Why has the Prime Minister not held a meeting, a First Minister's meeting, with all of the premiers, giving that in my home province, it's the leading cause of death for people the aged under 59 and under?
So I'll thank the member for the question. And you're right, we've spent about $1 billion to date on the overdose crisis, and we continue to make commitments towards it. But I would say that to the number of deaths that you are referring to, I would also say that we've overturned nearly 50,000 overdoses during that time. We've had 4.1 million individuals visit safe consumption sites. We've distributed over 1.5 million naloxone kits, which also go to saving lives. So to insinuate that the government has done nothing would, I don't really see that.
I didn't say nothing. I'm saying this, that in a health crisis, incrementalism costs lives. We demonstrated the urgent way we can respond and overcome barriers. We broke down barriers in all levels of government to respond to COVID-19. We need to do that here. You know, I went to Portugal this summer and I learned from the Portuguese about what an integrated, compassionate, and coordinated model looks like. But I also learned what a health-based emergency looks like. They rolled that out. They had 250 people on methadone. They scaled that up to 35,000. The Army came in and built labs and produced it at cost. They built 96 therapeutic treatment centers to create just-in-time treatment. When is your government going to respond like the health emergency that it is? Because Portugal had 100,000 chronic problematic drug users. We have 100,000 in BC, and we're half the population alone. When is your response and your government going to react like other countries around the world?
I'll thank the member for the question, and I would say we are responding. We have ongoing programs that are in place, but I would also say this. We recently met with our counterparts in Charlottetown, and province by province, we wouldn't necessarily always agree on the treatment programs, prevention, and harm reduction plans. Each province has its lens in healthcare of what it would want to do, but there was a strong commitment with my counterparts around the table to ensure that we are working together, and have actually agreed to meeting quarterly now because we understand the urgency. But this will take an all-level of government approach. It is not for the federal government to solely dictate how we intervene in this, because there's no one silver bullet, and we won't be able to overcome the toxic drug supply or the overdose crisis in a split second. It will take time, it will take planning, and it will take commitment from all levels of government to do it.
What's impressive for me is that we found a way to break down barriers within hours during COVID-19. But we are 8 years in. And what I'm looking to you, Minister, is to break down those barriers and demonstrate a real sense of urgency. I mean, there's things that we all agree on around this table. Let's advance them. Are you willing to do that? Are you willing to bring the premiers together, work with the Prime Minister, and come up with an urgent response to this crisis? Actually, urgent.
Okay. As I said, the first step towards
that's
that.
the last question.
Okay.
Just brief answer, please, and then we're going to move on.
As I said, I have asked my counterparts, and they've responded to have us meet on a quarterly basis to begin to address that urgency.
Thank you, Minister.